Morning. Christine Barnes here from the Bodyguard talking about reflux this morning. We'll just wait a few more moments. If you're joining us, welcome. Thanks for taking this time out of your busy day to join our little Facebook Live here. So we're going to be talking about reflux this morning. So let me know if you've listened to any of my other Facebook Lives in our lovely little group here. Not so little. We're getting a lot of people joining us, which is so exciting. So many people that are interested in their health and wellness. So I'm very excited about that. And I think it's fantastic that everyone's making such an effort to discover what's going on with their health and making positive choices. So my name's Christine Barnes. I'm a naturopath. I'm the consulting naturopath or expert in this group. My clinic is called the Bodyguard Clinic, and you can find me at thebodyguard.com.au. I do worldwide consults via telehealth. So just like we're talking here today, but it's with you privately. So lovely to join you again. So let's get stuck in to gastroesophageal reflux. So a bit of a mouthful there. We commonly know about reflux if we've heard anybody that has been experiencing heartburn. So that's another more colloquial term, if you like, but it does feel like your heart is burning. There's also reflux that's called silent reflux. And I've alluded to reflux on a few of our previous live recordings here and how that can be involved with one's health. And it's actually an extremely common symptom, and it is terrible. I've experienced it. I thought I was having a heart attack. I had no idea where this pain was coming from because it seemed to be all-encompassing. Some people, it's isolated to one spot, generally the chest or upper stomach. Some people feel it in the throat. Other people feel it in the back or the shoulders. And depending on how long it's been going on, it can actually set off a whole cascade of inflammation throughout the body. So it's definitely something we want to avoid. So let's get stuck into it. It can have long-term, very sinister outcomes. And I'm going to touch on some of those things. It can significantly impair quality of life. As such, though, we quite often just fob it off. I'm just getting a bit of reflux. Whenever I eat that food, I get reflux. And often it's only after years and years that we find that this escalates into a secondary problem that we don't want to have. So let's talk about some of the basics. What is it? What does it mean? What do we do about it? And there's some wonderful things within the natural medicine toolbox that we can do to relieve our symptoms and prevent. So essentially, reflux is all about the level of looseness or tightness of the junction between the stomach and the esophagus. So it's sort of down here. So we've got this tube that goes all the way down, yeah? And then it sort of spreads out and goes a little bit pleated around our stomach area. And at the top of that, there's a sphincter. Now, sphincter is just, an area, a junction where it supposedly is tight. Sometimes it needs to loosen off and then be tight again. So this is a sphincter. We've got many sphincters throughout our body. The anal sphincter is something you may have heard referred to before. So I'm talking about the sphincter at the top of the stomach. So when it's floppy, stomach's very acid. It's supposed to be acid. That's the breaking down of the food, unraveling those proteins. We want it to be like battery acid. But when the stomach sphincter at the top of the stomach, so it's got one at the top and one at the bottom, and in between there's this bag-like stomach. So at the top, It's our protection factor for that acid in the stomach to stop it splashing up into our airways, our esophagus, our throat. When that sphincter is loose, so it can get floppy for lots of reasons, and I'll cover some of those, this is when the acid comes up and we think we're too acidic. Now, it's just acid being in the wrong place. So we don't want acid up here. It's got to be in the stomach. Yeah? So we want that acid to be really strong. Now, one of the mechanisms, the feedback communication mechanisms that we have within our body is when that stomach acid is really strong, that sphincter should theoretically be quite tight. So when our stomach acid is low, which we can experience when we're stressed, eating the wrong foods, all sorts of reasons for our stomach acid being low, which I'm sure we'll get to cover in a future live Facebook. But when our stomach acid is low, the sphincter gets a bit floppy. That then allows the acid to splash up. And that's when we can experience burning or just inflammation. Some people don't feel anything, and then they discover through an endoscopy, which is when they put a camera down the throat into the stomach, they discover there's degradation of the mucosa, and that can cause discomfort when we're eating certain foods, etc., and general digestive discomfort. Again, that's topic for later, but today we're talking about reflux. So this is a major junction, and it's, when I say junction or sphincter, it's like a valve. So we want that valve to be open when we swallow food, drink water, and we then want it to close up nice and tight so the stomach acid can do its job, pull apart those proteins, and then signal to the bottom part of the stomach to open up and release that into the intestines. So we don't want to have a sphincter that is loose. Lots of reasons for that sphincter to be loose. I'm going to go through some of those things, but one of them can be loss of collagen. So I'm a postmenopausal woman, so there is, with loss of estrogen, there can be loss of collagen. And sometimes it's not got anything to do with that. It's got to do with that we're not consuming or breaking down those nutrients that build collagen. Yeah, so collagen's involved with some of those junctions in keeping them flexible, making sure they can be tight, open up, all those sorts of functioning. So it can be loss of estrogen. It can be be aggravated when we're in menopause or postmenopause, or it can be when we're deficient in some of those nutrients that support collagen production. Or it can be from low stomach acid. It can be that the feedback mechanism isn't open, isn't communicating. So many different things. So the stomach, we want strong acid. We want the sphincter to close nice and firm so it doesn't splash up into our esophagus. Yeah. So when it does splash up, it can cause the common heartburn, things like that, but it can also cause some other odd things like bad breath, chronic cough, so that clearing our throat. I often clear my throat when I get a bit nervous before doing these lives and need to drink some extra water. But a chronic cough can actually be from reflux. Just take a sip of water. Everybody take a sip. It can produce chest pain. My experience of it was I felt like I was having a heart attack. So pain can be, off to one side, can be in the shoulders, can be in the back, can be in the front. We can have reflux where it regurgitates, so the stomach regurgitates fluid into the mouth. So like a vomit, a mini vomit, if you like, which is very unpleasant. It can cause breathing problems because that irritation up into the sinuses can overproduce mucus, so we then start spiraling into other problems. It can actually bring on dental decay. So we see this sometimes in little ones who have reflux, especially when there's fructose malabsorption, and their regurgitating the acid. It's then breaking down the enamel on the teeth. Yeah. So lots of other reasons for that. So I don't think it's just because of that. It can, enamel can degrade purely from mineral deficiencies, all sorts of things. Now, what happens when we've had reflux for a while? It can get more sinister. And why am I talking about this? I'm not trying to scare you. So I'm really just trying to let you know it's really important to get the reflux sorted out, protection factors in place, and also define what is that underlying driver. Yeah? Otherwise, you're just putting band-aids on all the time, which sometimes is important to protect the esophagus and stop you spiraling into more sinister aspects of illness, which we don't want. So let's say we've got a situation where we didn't really know we had a problem that was something that needed treating. We just thought everybody gets reflux, and years go on with this reflux that seems quite minor. It can then burn the esophagus to the point where it starts changing the cells, and the cells can go cancerous, and that's called Barrett's. It can lead, when Barrett's becomes more chronic and aggressive, it can then turn into esophageal cancer. Terrible cancer to get. There's no good cancer, let's face it, but that in particular is awful. So there are different stages to this, and at each stage there's an opportunity to put things in place to turn it around. But of course we don't want to be at that point. Yeah. Now, if you have been diagnosed with Barrett's or esophageal cancer, please get in touch. These things need very targeted treatment, very comprehensive treatment. Today, we're just talking about the do's, the don'ts, the what is, the just generalized stuff about reflux. Okay. So, silent reflux is when we don't feel the symptoms, but it is still happening. We're getting this like mild burning that's going on, and it can then cause other issues longer term, and even funny little minor issues that we think are completely different, like respiratory symptoms, sore throats, all sorts of things. But it's very common. So if you've experienced reflux, or you think you've experienced reflux at any time, pop a message there and just let us know. I think it's really important for us to start the conversation and keep the conversation going. If you're not sure, pop a little comment in below, and let's, after this talk, let's continue the discussion and, make it part of things that we can keep our eye out for and do something about. So reflux symptoms in some people can just be aggravated because of certain foods. We do know there are common triggers, and they're not the cause, but they can trigger an event where we experience pain and reflux symptoms. And it can vary from being mild and transitory to chronic, part of every moment of our day. There are some health situations and status that actually predispose us to reflux. Obesity. So when we're overweight, especially abdominal obesity, it can put pressure on the lower part of the stomach and confuse those signals and interrupt that whole digestive system. Inappropriate diet, so eating too much, stretching that stomach with one meal being too big, and then that holds the sphincter open. For some people, if their breaking down of fats isn't efficient, usually associated with low stomach acid and an under-functioning liver, it can be fatty meals that, like fried foods, chips, bacon, things like that. So again, if we're experiencing that from those particular foods, we want to actually address the holistic aspect of that. Strengthen the stomach acid, address maybe the enzymes that break down fats, make sure you've got adequate levels of those. It may be that we need to improve the liver function as well. Meals high in refined carbohydrate can also be an aggravator. So commercial foods, starchy grains, things like that. Soda pop or soft drink. Soda pop, I think, is an American term. Australia, we call it soft drinks. So sodas, those sorts of things, again, they can aggravate. Spicy foods can be an aggravator if that sphincter is not tight. So that can be another one. If you've got salicylate sensitivity, sometimes salicylate sensitivity can produce reflux. Tomatoes are a common aggravator. So tomato sauce on pizza. So there's a double whammy. So tomato sauce, pizza, so refined carbohydrate on the base. And then if we've got some refined fatty meats on top, it can be a huge assault for those people that are, having reflux type symptoms. Excess sugar can produce it, eating too quickly, fructose malabsorption. I often see with little children that have fructose malabsorption, they commonly have severe reflux. So little ones, infants, can be pushing their chest against furniture or the floor, holding themselves, especially when they're nonverbal, they can give us little hints of experiencing reflux, and that's something that we want to sort out as soon as possible, because little ones in pain, that creates then a barrier for eating food. So yeah. Alcohol, big one. And again, for fructose malabsorption, alcohol or sugar alcohol, so xylitol, can aggravate reflux because it's a sugar alcohol. Coffee, I love my coffee. I only have one fantastic cup. There's a lot of pressure on getting the right cup of coffee. Those that have heard my podcasts and Facebook Lives before will hear me talk about coffee, but too much gives me reflux. Chocolate, because it's caffeine, and it also is a source of benzoic acid, and that for some people can produce reflux. So sometimes it's about the volume. I'm fine on a good shot of coffee, I'm fine. A little bit of chocolate, I'm fine. For many people, it's like that. Sometimes it's about overindulgence, or maybe when it's too many things, spicy foods, coffee, alcohol, fatty foods, all over a day or a few days. It can build up, and then we can find a few days later we've got this series of reflux symptoms. Smoking, interestingly enough, can create reflux. Anxiety can create reflux. Stressful events. Sometimes we see reflux is triggered, never been well since this situation, and then it spirals into other things. Pregnancy, again, similar to obesity, and sorry, I'm not meaning to put those two things together, but that pressure on the lower end of the stomach really can aggravate our digestion. Over-exercise can also create reflux, so many things. Getting to the bottom, the underlying driver, really needs a thorough investigation and working out what's going on. Hi, Ankit. Thanks for joining us there. Yeah, stop protein pump inhibitors 2 weeks ago. There you go. Yeah. So I'll talk about protein pump inhibitors soon. So started ACV, yeah, and that can be really helpful as long as the stomach is not too raw. So if we've got ulcers in the stomach or it's just too inflamed, apple cider vinegar, although it's fantastic, can aggravate those things. So yeah, very important to get the right approach and in the right order. So really anything that disrupts that junction from being closed at the top of the stomach can aggravate and drive reflux symptoms. Delayed gastric emptying. So being constipated can cause reflux. So this is called gastroparesis. So not a true constipation, but a slowness of the emptying between the junctions, slowness of emptying of the stomach, and slowness of the stomach into the small intestines, slowness of the small intestines into the large intestines, slowness of getting into the colonic area, all that sort of thing. Just slowness and building up can backing up of the plumbing, if you like, can drive reflux. But constipation can do that, and also gastroparesis, which is sort of a type of constipation. Also not pleasant. So that's what's called delayed gastric emptying. So something to check in on. We want to make sure that this beautiful symphony of digestion that starts here in the mouth, all the way through the plumbing, all the way until it comes out the other end. It's got to be the right timing, things opening at the right time, and nice, gentle, slow but steady process. So let's talk about it right from the top here, from the mouth. So insufficient chewing and saliva. Now, as we get older, sometimes we do have reduced saliva. So older people with lots of dentures, that can be a problem sometimes with chewing. So saliva is really important because it alkalizes the esophagus. So on that journey going down through the esophagus, it alkalizes it. So it puts a barrier for when it hits the stomach, which is really acid, and it needs to be acid when it hits there. So that alkalinity that is around that food, that bolus, what's called a bolus of food, after we've swallowed it, and it's heading down the esophagus, that also signals that, that junction needs to be tight until that bolus hits that point, and then the junction opens and lets it in, like a door, yeah? So we want the door to open and then close, yeah? Reduced peristalsis in the esophagus can aggravate reflux. So what does that mean? Peristalsis is that lovely movement. Now, I don't know as a child whether you've tried this little experiment. I was fascinated by it when I was younger, which was many years ago. But when I used to do headstand, I'd play with having some water, then go upside down after I'd swallowed it, and it would still make its way to my stomach. It never ran out. So I always was fascinated by this, and it really fed into me, pardon the pun, of discovering more about the digestion and how it works. And the muscle of the esophagus through here is pushing it down. It's got this slow squeezing, and it's pushing anything, including water, down into our stomach. Yeah? So it's like a little slow train going down. Sphincter opens, bolus goes in, sphincter closes. Now, if there's something pulling that sphincter open, it's not going to happen that way, and it's leaving you exposed to that acid. And I'll talk a little bit about some of those physical implications that may be involved with your reflux. So chewing is important. Feeling relaxed is important during meals. So the esophagus can relax. Otherwise, it'll be like this, yeah? So it's not allowing that food to go down. So that's all about peristalsis, or the movement. And we've got peristaltic movements all through the body, yeah? Food allergies can create reflux. Some people have a sensitivity to gluten. Some people are celiac, which means they've got a true allergy to gluten. And gluten comes in many, many different foods. Can you believe it? It even comes in ham. So not true traditionally made ham, but more commercial versions. And you will see at the supermarkets, they'll say gluten-free ham. Yeah. So yeah, dairy can cause reflux in sensitive individuals. So working out what your sensitivities are can be helpful. Medications, quite a lot of pharmaceuticals can reduce the junction between the stomach and the esophagus. Calcium channel blockers, diazepam, morphine, nitrates, nitrate-type pharmaceuticals, nitrates in foods, progesterone, so those people that are on HRT, that might be progesterone aspect or a strong progesterone aspect to it. And if you've had progesterone deficiency and on progesterone hormones, it may result, not all the time, but it has the potential to weaken that sphincter and reduce the junction pressure, yes, and not as tight. Tricyclic antidepressants also can do that. So if you're on any of those pharmaceuticals and are not experiencing reflux, it may be a good idea to make sure that you're managing all this digestion in addition, and make sure you don't end up heading down that reflux pathway just purely driven from the pharmaceuticals. Please don't stop your pharmaceuticals without visiting with your medical doctor. Let's talk about stomach acid. I'm really passionate about stomach acid. It's affected by everything. Our bodies, when our bodies are really quite ancient how it functions. So when we're in sympathetic nervous system dominance, so in that the body thinks we've got to stand and fight or run, that's sympathetic nervous system dominance, it takes the energy from the digestion and puts it in our peripheral because it thinks you need the energy to run or fight. So peripheral, hands, running, feet, yeah? And digestion takes up a lot of energy. It's basically all we are is a big digestion factory with a few things on the edge, head where the food goes in to be digested, hands to collect the food to be digested. So really, we are just a digestion factory. But we forget about that. We think we're all these other things. So when we're in sympathetic nervous system dominance, and many of us are at times, right now I'm in sympathetic nervous system dominance because I need enough adrenaline to overcome my anxiety about speaking to you lovely people, because it's quite nerve-wracking coming online and seeing yourself and all that sort of thing. I'm sure many people out there can relate to that. So when we're in that sympathetic nervous system dominance, which can be from overwork, it can be stress about neighbours complaining, problems at work, problems in our relationship, so many different things can switch us into that sympathetic nervous system dominance. What happens is that our stomach acid shuts down. Not a problem if it's just for a few minutes, half an hour, even on one day. But often it's every day over a long period of time. And that can be a problem because if our stomach acid is too low, we can't break down the nutrition that we're consuming. Oh, Megan, you're so sweet. That's very sweet of you. Thank you. And do, pop questions into the comments. If you're listening to this on a recording, pop your comments in. Feel free to tag me. My name's Christine Barnes. I'm a naturopath. My clinic is thebodyguard.com.au, and we treat worldwide. So, okay, we're at the stomach acid. Really important to keep it strong and acidic so that sphincter stays tight. Yeah, we'll have less food sensitivities if our stomach acid is strong. Once our stomach acid gets weak, we can have reflux, food sensitivities, we can even get constipation or diarrhea. So really, when they talk about the stomach being the center, and in yoga esoteric terms, it is, a very strong, fiery chakra. Yeah, it's a Manipur chakra, and it's really the seat of burning things up. So we want to be able to burn that food up in our digestion, have what's called in Ayurvedic terms or in some traditional medicine terms is digestive fire, and that's that stomach acid. So we want that. Okay, so let's just say we're experiencing reflux and we want strong stomach acid. Please, please, please be cautious about increasing your stomach acid. It is a bit of a paradox because once that sphincter is open and the stomach acid is splashing up, we actually have to put some protective factors in there until we get that sphincter strong enough to close up, and then as a secondary thing that will build up the stomach acid. If you just go for certain nutrients to increase stomach acid, you will get more severe reflux symptoms, and it can be absolutely painful and cause damage. So things need to be done in the right order if you do have reflux and that sphincter is loose. So first step is we need to find out why it's loose. Yeah. So it could be just from low stomach acid, but it may be from what's called a hiatal hernia. Weird term, I know, hiatal hernia. It's spelt how it sounds. And this is basically where we've got a hernia that's pulling the sphincter open. So sphincter's a hole, yeah, that closes up and opens, closes up, so it's a muscle. And if we've got a hernia that's pulling it open, it can't close up. It's pulling it open, yeah. So some people don't even realize they've got a hiatal hernia. I had a patient recently, terrible things going on. It was supposedly allergic to just all food, lots of pain, lots of inflammation in the shoulders. And we put some things in place to give symptom relief, sent him off for some testing in investigations with his GP. They discovered this giant hernia that was just pulling the stomach open. So, we've gone down that path of looking at surgery, and it's just keyhole surgery for correcting that hernia, because his hernia was at a size that it wasn't just going to eventually go into place. Some osteopaths can help you with smaller hernias that just need readjustment in there. You can also do what's called heel drops that help the stomach just by stretching and just creating a bouncing effect that actually brings the sphincter a little bit close. But if it's being held open by a hiatal hernia, it will not help. Yeah. So, and what you can do with the heel drops is on an empty stomach, drink, a reasonable amount of water. I'd say 500 ml, if you can fit that in on an empty stomach, and just go to a step. Be safe. Make sure it's not slippery. Obviously, if you've got any ankle or feet injuries, or even knees that are a problem, this may not be possible for you. But if you're generally healthy in your lower limbs, you can literally have the balls of your feet on a step and then just drop your feet in a little fashion that bounces that water that's in the stomach, and then that bag, which is your stomach, just does a little bounce, and the sphincter at the top of the stomach then tightens a bit. Yeah. But as I say, that won't be helpful if that sphincter is being held open physically by something. So it's a good idea, if you're experiencing reflux, just to explore and find out what that underlying driver is. So this is a huge topic, and I could go on and down all sorts of rabbit holes about reflux, fructose malabsorption and its relation to reflux, stress and its relation to reflux, so many different things. But I'm going to give you some things to do now that are going to be helpful. Even if you're suspicious you've got reflux and you're not sure, these things are easy to do. One thing is to raise the bed head end of your bed. So that's where your head goes, the pillow end. And it's best not to prop pillows up underneath there. It's actually to get nice, smooth and comfortable elevation. And there's a few different ways you can raise the bed head end. If you've got just legs and you've got access to something to chock up underneath that end, you only need it about that high. We just need some elevation. So if this is your head, you just need to make sure that the torso, the head end, is slightly higher than, say, the baseline. Yeah. So meaning, your sacrum. Yeah. Stomach's in the middle here. We just want to make sure that we don't have leakage of that acid overnight into your throat. Yeah. And medical doctors, they're not trained in a lot of these things, because some of the things I'm going to suggest today, they're naturopathic, they're wellness. So medical doctors, we need them because they're very important for, disease and things like that. Protein pump inhibitors, which PPIs that you mentioned, I'm going to talk about those in a moment. So a doctor can actually prescribe proton pump inhibitors. Bit of a mouthful, but this is naturopathic. So with these sorts of things, definitely we want to go to a medical doctor who may prescribe a proton pump inhibitor, may be able to diagnose hiatal hernia. But there's much that can be done to prevent and to manage and reduce the severity of symptoms and then resolve. And that would be under the naturopathic and nutritionist regime of treatment. So, but good point there, Ankit. So, yeah. So, first step, raising that bed head. You can also go to some of these rubber companies. In Australia, there's Clark's Rubber. They sell a foam wedge. So a wedge, and you can put that underneath your mattress just to do that elevation. So that's one thing that you can do. And if you're in a double bed sleeping with a partner, or in a double bed sleeping by yourself, or a queen or a king, you want to do the whole area of the bed head. Otherwise, you've got one corner up and that's all very uncomfortable. So just that head end. Another really simple way to do this, and you know, I'm old school. I've just had my 60th birthday, so I'm remembering all these things in the early days of natural medicine, what we used to do before we had these things that we could, interventions and investigations. And one thing we used to do is just get an old blanket and fold it up and over and over and over. So it's long and narrow and is the width of the bed. And then just lift the head end of the mattress up and just put that blanket underneath your mattress. And that just gives you that tilt there as well. So that's so the acid doesn't, during the night, drip into the esophagus, causing problems. Sometimes we don't even know what's happening. And I've had cases where just doing that one thing brings relief. And then the patient goes, oh, it's like I don't have reflux at all. So it doesn't solve the sphincter, but it can bring relief. So really important aspect to consider. And lots of different ways to go around that as well. And, you know, there's no problems just doing that. And if you don't have reflux, it's not going to cause a problem. So that's a real simple thing. Let me quickly talk about proton pump inhibitors. So proton pump inhibitors sometimes in acute states of reflux are important. And basically they just reduce the stomach acid. So if you've been prescribed a proton pump inhibitor, it's definitely for short-term use. Talk to your medical doctor about this. It is a Band-Aid, and sometimes we need that Band-Aid to make sure that the damage that can possibly be caused to the esophagus is not going to eventuate, which can long-term turn into Barrett's, can turn into esophageal cancer. So we don't want that. So proton pump inhibitors, short-term use, can reduce the stomach acid, but there are a lot of other things that can be done as well. Sometimes we need proton pump inhibitors or PPIs, but short-term use. There is quite a bit of research about proton pump inhibitors, and long-term use has very negative outcomes. I don't want to scare you, but like any pharmaceutical that's not necessarily designed for long-term use, it can produce very negative outcomes. So, you know, but sometimes we need them, yeah? And sometimes we need them, but they're short-term. And there are lots of other ways of reducing that stomach acid, or more importantly, putting a protection factor on the stomach so it doesn't splash up. Adjusting the bed, as I've discussed, investigating the underlying driver, avoiding the aggravators in your diet. Certainly, I wouldn't like to see proton pump inhibitors used in 99% of cases for longer than a couple of months maximum, because as the stomach acid is longer and longer reduced in its strength, we then have deficiencies that develop, because the stomach acid needs to be strong to unravel those proteins, and so you can absorb them. So we end up with things like B12 deficiency, all sorts of things, all sorts of deficiencies, food sensitivities increase, all that sort of thing. So there are problems to taking that approach long term, but there are some severe cases where we need some form of protection, where we can't get that sphincter closed. They're more unusual, more severe, and they certainly need an integrative and multi-pronged approach to protect people from those negative consequences of that stomach acid. Slippery elm, fantastic for protection, and that can be taken before and after meals. Again, I don't recommend that long term because it can bind to the minerals and carry them out, but short term relief, definitely helpful. I take slippery elm every day because I find as a postmenopausal woman, it's really helpful with maintaining healthy levels of mucus on my mucous membrane. So think the esophagus, the stomach, all that sort of thing. So I find it a fantastic product to use, but I separate it from any medications and any supplements. So you can hear that I'm recommending things, and there might be particular times to take certain things, yeah. But there's much that can be done, and sometimes we need to address, say, some gastritis before we build up the stomach acid. So again, we need to have a differential diagnosis of what's going on in that upper digestion. Do we need to put some things in there to protect? It might be slippery elm, it might be DGL, it might be aloe, things like that. These may not be right for you. You might be ready to increase your stomach acid, and that's a different stage of the treatment. But the first thing to do is to switch the diet if you haven't already done so. So there's plenty of fiber in it. There's lots of green leafy vegetables, healthy fats and oils, and a good variety of food, and reduce unhealthy fats, refined carbohydrates, sodas, sugars, alcohol, coffee, chocolate, chili, overspiced foods, especially in the case of severe reflux. The next thing I'd recommend is introducing mindful and slow eating to reduce that stress and ensure that the whole digestive tract, right from up here all the way down, is effective and it's producing enough saliva that you can smell the food. So this is when making your own food is really helpful for your digestion, because that switches on the digestive enzymes. Choose small portions. Don't eat large meals. Don't drink water or fluids. Separate that from meals. So do drink water, but separate it from meals. Yeah, don't be sipping water with meals. It waters down your digestive juices. Reducing the size of meals. Sometimes we sit down, we have this giant meal because we haven't had time. Maybe what might be better is smaller size meals, so we don't stretch that stomach and keep that sphincter open. We may need to look at things like lifestyle, smoking, over-exercising, not exercising enough, exercising too close to meals, exercising with a full stomach. We may need to look at weight. Importantly, we need to address any anxiety or stress, and that can be, require a wide variety of interventions. So that all needs to be looked at, assessed, and addressed. I've talked about putting a wedge or something to raise that bed head and the head, where your head goes, that end of the bed. Avoid tight-fitting clothes around the stomach short term. Walking and getting adequate exercise. Obviously avoiding anything upside down. I do have a patient that experiences reflux whenever she's upside down, so we just stopped those exercises until we strengthen the stomach sphincter. So some supplements that are very helpful are slippery elm, marshmallow, DGL, zinc carnosine. Ginger tea can be helpful as well. We need to ensure that we're adequately hydrated and the timing of that hydration. Sometimes we need to introduce some anti-inflammatories and antioxidants, but that's on a case-by-case basis. We definitely all need to ensure that we've got healthy peristalsis and that our calcium to magnesium ratios are appropriate to help facilitate that peristalsis. So peristalsis, remember, is that movement through the esophagus and even below the stomach, the peristalsis. Probiotics sometimes can be helpful for that gastric emptying. I'd say the biggest issue around um, reflux is stress. And commonly, these things start after a stressful event. Sometimes we need to revisit that and work out, have we processed that stress as well, and put stress management in place. But certainly, there's a lot we can do, and it's important work to do. So if you're a bit confused about what I'm saying and you don't know how that applies to you, just reach out to myself or one of my team. Happy to have a complimentary chat, seeing if you need further treatment or whether it's just one or two things that you need to put in place. Of course, ensure that you're asking questions down below. Megan has a fantastic team of experts, including herself, on diet and some things, simple things that you can introduce. So if you're listening to this recording, still post your questions down below and also tag me if you want my input. So I don't get to see you unless you tag me. So do that. I hope today's been helpful. Let us know if you've got some helpful tips. I'm sure I'll be dropping in to Megan's group here. It's such a fabulous group of people. The gut health community support and chat. I mean, let's support each other. Let's chat. Let's work further on our gut health as a community together. And if you've got some topics that you'd like me to talk about in the future, I'm sure that Megan would welcome your suggestions, and I certainly would as well. We're here to help. So keep the great work up out there, manage stress, eat well, and I look forward to talking to you soon.